Tatum. The skill I will be performing today is foot care. First, I'm going to check my assignment sheet, and I'm going to perform hand hygiene, sanitize my hands, and then next I'll grab my materials. 1 basin, 1 towel, 1, 2, 3 washcloths, pair of gloves, and then lotion and soap. Then I'll head to my residence room. Hello, my name's Tatum. I'll be your CNA today. Is it alright if I come in?
Yes.
So, can you confirm your name and date of birth for me, please?
Ella Scottler, 1206.
So, Ella, today I'm here to perform foot care. Do you have any questions for me?
No.
And are you comfortable?
Yes.
Awesome. Before I get started, I'm going to close the privacy curtain, make sure the bed is locked, and then I'm going to set up my supplies down here, starting with my barrier towel. And Ella, I'm just going to move this right over here. Towels, gloves, supplies. And then Ella, I'm going to make sure you have your call light, and I'm going to go grab you some warm water.
Okay.
Alright, I'll be right back. Head over here to the sink. Turn the water on to warm. Fill my basin. Once my basin is filled, I'm going to test the water with my wrist. Head back to my residence room. Hello, Ella, I'm back with your water. Can you test it for me? Check the temperature.
Perfect. Thank you.
Awesome. I'm just going to place this right here. I'm going to apply my gloves. And then Ella, I'm just going to lift your foot up and I'm going to place it into the basin. I'm going to get my first washcloth wet. Going to rinse it. And then I'm going to apply soap, not over the basin. Then I'm going to scrub it all in. Then I'm going to take your foot out of the basin. Scrub the top of your foot. And get your ankle. Get your heel. Down to the bottom of your foot. And then I'm going to make sure I get in between each toe. And I'll set your foot back into the basin. Next, we're just going to rinse with water. And I'm going to grab your foot. Going to rinse the top of the foot, the heel, ankle, bottom of the foot. Then going to get in between each toe. Going to throw this in there. Then I'm going to move that basin to the side. I'll have you set your foot down. Then next, I'll dry your foot, top, ankle, bottom of your foot, and then in between the toes. Down. And then I'm going to get some lotion. And I'm going to rub it with my hands and get it all warm. I'm going to grab your foot. I'm going to make sure to get the top of the foot and the bottom of the foot, avoiding getting in between the toes. And if there was any excess lotion, I would wipe it off, but there is not, so I will not do so. That, and then I'm going to grab my supplies, roll this up. And then, Ella, that is it for today. Is there anything else I can do for you?
No.
No? Alright, are you comfortable?
Yes.
Awesome. Before I leave, I'm going to open up the privacy. I'm going to make sure your bed is locked. And then Ella, here's your call light. Thank you. And then you have a good rest of your day. Thank you all. And come over here. Going to put my soap in motion now. And then since it was below the waist, I'm going to dump it into the commode. Going to rinse. Dump it into the commode. Then I will dry the basin. And then I will put it into the dirty designated area. I'll remove my gloves, glove to glove, skin to skin. And then I would throw that in the medical basin. And then I would hand sanitize. And then I would report, record, end of skill.